Recent research has indicated that there's been a significant shift with when the viral load for SARS-CoV-2, the virus that causes COVID, peaks compared to when a person first starts having symptoms. Now, this can have a significant impact on recommendations as to how long a person is contagious for how testing goes, and for quarantining. So let's talk about it. Hey everybody, it's Dr. David. Good to talk to you today. As you know, I have been on the forefront of the COVID fighting the battle of information, as well as fighting the battle for misinformation, but also really doing a deeper dive as we've gone through each phase of the pandemic and now into the endemic, using my independence to really try to assess what's going on at the moment and make the best recommendation at the time, or at least to help people think about things that they hadn't thought about already. And of course, as information evolved, there were things that we got right. There's things that we got wrong. Most of it we got right, though. So, but I've on this channel here, I've made videos about COVID vaccines, my presentations to the FDA, the authorization committee, to go ahead and make the approvals for this. I've talked about natural protocols. I've talked about ivermectin, Paxlovid, other types of treatments, monoclonal antibodies. And of course, I've also talked about how long a person might be contagious and maybe sick for. So if you go back, if you want to see about my past thoughts, it's all right there on this channel. Okay. Now, first thing, let's talk about what a viral load is. Okay. So the viral load is how much virus would be found, like, for instance, on a swab at any given time throughout the course of the illness. Okay. The higher the viral load is at any given time, the more likely that a person is contagious or more contagious than they would be with a viral load that's lower. Okay. And of course, the higher the viral load, the more that you may find on a swab, the more likely that test is to be positive when you're doing either a PCR or a rapid test. Now, of course, rapid tests are readily available still. They're easy to do. They give you quick answers. Okay. But of course, the question is, well, if the main goal, if somebody wants to swab themselves and test for COVID, is to know whether a person has COVID. And of course, if the viral load on the first few days of symptoms is still pretty low, then a person may do a test and said, oh, I tested for COVID, I didn't have it. But in fact, they were contagious and just didn't know about it. So that can be a little challenging, especially for people who are around high-risk people, people with cancer, or people who are seniors who may have, or people who have cardiac disease or renal disease, pulmonary diseases, immunodeficiencies. And if we're trying to obviously keep our loved ones or our friends, or even people we don't know, but hey, we're trying to be a good citizen. Of course, when we're at our most contagious self, or when we're contagious, we have to ask ourselves, should we be out in public or private, potentially exposing people to things? And of course, this could change this significantly if the swab is showing negative, but you still have the virus, or you think you're fine. And then 2 days later, when the viral load is higher and you don't know about it, and you could be then passing it along to somebody else who may do worse for it than you did. And who knows, right? Obviously, you don't know who in your household could do worse. It's been really weird. One of the things I've seen through the pandemic is you would think that a person would have the worst disease the first time they get it because they have immunity. And that's not always true. I've had lots of patients who, man, the second time was worse. They said that Omicron would be easier than the original strain, but I found Omicron was much more difficult on me or my family. So there's still a lot of variability within the disease itself. Okay. So now, one of the things about PCR tests, and of course, I know we've talked about this before, is because there's an amplification when they do the PCR process. So they actually are amplifying the genetic code. So they can potentially find the virus in a lower swab because of the way they replicate. And so that's one of the things that, that of course we have to be aware of in terms of the two different types of tests. Okay. Of course, usually the PCR tests are done at a healthcare facility, at a lab, somewhere where they can collect it and send it off to a lab, etc. Okay. Now, early in the pandemic, one of the things that we saw was that the viral load was peaking really at about 1 day into 2 days of the onset of symptoms. Now, of course, anybody is going to have some virus in them before they would get contagious, because it has to grow enough and create the immune response in order to make that happen. Because remember, going back, we talked about how when a person's sneezing or coughing or snotty or with the fever, that's all our body's immune response to the rapidly growing virus and trying to put it down. But now, if we're in a situation where the symptoms start, maybe the symptoms because they don't peak as high, we don't get as high, but also because our immune systems, if we have immunity already, and of course, whether that is from natural immunity, vaccine immunity, or hybrid, then the virus isn't going to grow as fast and peak as quickly before it starts to come down. It's going to kind of take more of the slow on. But in the meantime, because our antibodies and our white blood cells are fighting the good fight, we're seeing the snot, we're seeing the fevers, we're seeing the cough, the rundown feelings that people can be getting and still do get from the virus. Okay, now, of course, that could also explain why there is more a lot of asymptomatic spread, because of course if you have immunity, you may not even show symptoms for a few days, and of course during the time period maybe you are potentially still contagious, although not as much as when the virus hit, but you could be contagious when you are asymptomatic, which we've talked about that for for a very long time. Okay, now another thing, obviously, just if that when the viral load peaks fast, when you just do when you do the test at the peak of the viral load, then of course the test will more likely will be positive. Now, there is some new research that I kind of had alluded to before. This was research that was done at Emory University. They actually first, but they found, and they were using PCR testing because that way you can kind of count the viral load as opposed to the rapid tests, which are just positive or negative. Okay. And so they had 348 people who tested positive for PCR. Now, 91% of them had either been vaccinated or had, again, had natural immunity. But, and obviously we can test for these through the antibody tests that are done. And what they found, as I said, is that the median, so that's the middle, the average, not even the average, but like the middle number of days. So, you could have a 1, 3, and a 5, and the median is a 3 there. You could have a 1, a 1, and a 3, and a 4. And my math is correct. That could still end up being like a median of 3 as well. So, but at the same study, interestingly, because they were also testing people, it was a combination influenza COVID test. And they found, even though people have been having, influenza for a long time, although less often during the age of the pandemic, it was 2 days still before the virus load will peak for influenza. So again, quicker onset, quicker likelihood to find the positive test, and to take the measures that are necessary. But what does this mean in real time? Okay. As I said, because the immune system's kicking in, fortunately, a high viral load does not necessarily mean how sick you're going to be. Okay. It's how our immune systems are at baseline and all the things that we do to keep a strong, healthy immune system, as well as what our immunity is for the particular virus, that makes a difference with how sick we're going to get. Okay. But of course, when we have that fast antibody, that's why we also can get kind of a quick cutoff and a decrease of the virus itself growing, even though the immune system causes all of the symptoms. Okay. But of course, if you check too early, you're probably not going to test positive. So again, just don't be lulled into a false sense of security that you or a loved one doesn't have it if they're symptomatic, but it's early on and they test. Okay. Now, of course, one of the issues, though, people will take different types of medications and treatments for COVID. We've certainly talked about that on this channel and the natural things that I do, and even some that are more specific for virus, for COVID. But of course, if you're testing negative, you may not start that soon enough. And so you may be a little bit later to helping your body's immune system boost it. But of course, that's the reason in our immune support protocol, which I've talked about many times here, the high doses of vitamin A, along with the higher doses of zinc, vitamin C, and echinacea, or the active ingredient called arabinogalactan. That's the reason why we say on the first sign of any illness to start these things, because you don't really want to wait around to find out what you got. Okay, same thing, like you think of it unrelated, but chickenpox, right? It starts off with a cold or flu-like symptoms. Not till later on do you get the pox. I would rather have everybody start boosting their immune system on the first sign of illness. Okay. So in terms of my take, again, as soon as possible, start the immune support protocol. Okay. Now I know that all of our patients and our Patreon subscribers, our members there, they have access to our full holistic protocols. So if you're not a patient but you want to have access to them, you can certainly join up on our Patreon and be a supporter there, where you'll have access to all of that information. But at the same time, if you test negative but you have symptoms, maybe you want to consider laying low for a few days. Maybe seeing if you could work from home or not go to school, just to kind of make sure that it's not going to turn into something more. And then maybe doing the test a couple of days later, and then seeing if you test positive before you make any more final decisions on who you're going to see, visit with, etc. Okay. Now, of course, still avoiding people who are sick. That's kind of a general rule of thumb that we always knew about. But of course, since you don't know who they have, if you're around them, then you have a better chance of catching whatever that virus is, whether it's COVID, influenza, RSV, or any of the other multiple of viruses that are out there. Okay. So, but another final question here, which is interesting because, the CDC recommends that you can be out of quarantine after day 5 of your symptoms, right? And they still say mask up, etc. But of course, if you're not peaking until day 4, that means you may very well be contagious past day 5. Okay, so I'm wondering if the CDC is going to need to make some recommendations for people who want to follow the CDC recommendations, because I'm now questioning whether those are accurate at this point. All right. Well, some new food for thought here. Obviously, I hope everybody does make it through the cold and flu, and I don't know if I want to call it the COVID season, because I don't know if we have a COVID season yet. They seem to kind of pop up a few times a year. But nonetheless, as we're heading to it, make sure you got your good vitamin D levels, make sure you got your good zinc levels, and start that immune support protocol right away. Have a good day.